Today we are in talk with Girish.
The shift is in the mindset of the patient. Information is the king, especially hospital where there's a human touch required.
The demands or the requirements of the patients have changed.
This WhatsApp university has now become very big. So
Today we are in talk with Girish, a seasoned healthcare IT veteran and an industry leader whom I have known for past 5 years. With a deep passion for innovation, he has been instrumental in transforming healthcare technology and operations. Girish dedicated 11 years to Leelavati Hospital and Research Center as Senior Manager IT, where he played a pivotal role in advancing healthcare systems. We welcome you to InTalk. It's been a pleasure to have you with us, sir.
thank you very much, Digesh, and a big thank you to Intalk and team for having me here. I feel very privileged to be here. Just to add to the introduction, I would also like to inform that I had a opportunity to work with multiple domains. Hospital healthcare being the last domain. I started my career as an engineer in the textile industry, then moved to manufacturing, and now with healthcare. So I have a various background of multiple domains, and I have seen different domains at different decades. So I have seen technology grow through the past 3 decades. And this currently healthcare, I think I'm enjoying the most, and I'm at the right time at the right place.
You have seen healthcare evolve firsthand over the years. Looking back, what's been the biggest shift in how technology is shaping patient care today?
See, as I mentioned, I've been in this industry for almost 1.5 decades. So the shift is in the mindset of the patients and the doctors. Initially, patients used to walk in and the hospital used to treat the patients. So the hospital was the king. I'm talking 10 years, 15 years back. Now with so much of information being available over the net and the patient is getting more and more educated, and the demand for more and more things is from the hospital. When you go to the X hospital, this is available, you go to the Y. So because the patient awareness is grown leaps and bounds, so it's all the more imperative for a hospital to be at par with them and treat them accordingly. So information is the king. So how you educate the customer, how do you enhance the patient experience, that is the key. Some time back, hospitals used to more think about how to enroll new patients. Now hospitals have realized they also need to retain the patients. So to retain the patient, customer experience is one of the key things. So we are at that stage where we want to retain the patient. We want the patients to come back. So that is what has changed in the last 1.5 years, mostly after COVID.
So in a way, the demands or the requirements of the patients have changed.
Yes, because the patient has become more educated. He knows.
He's more aware.
Yes.
Okay. We have talked before about the role of tech in optimizing hospital operations. How exactly is it helping with patient footfall and overall efficiency?
See, again, if you move some years back, nothing was available on the net. Now, a patient can do everything except getting operated in the hospital. Like he can do an online appointment, he can online consultation. So now hospitals has become a hybrid model. Only if it required, you need to come to the hospitals. So that ease of this is changed. So now patients know I can do appointment booking, I can do a teleconsultation, I can go to XYZ if I don't like this doctor, I can do a consultation in a city where I don't stay, I can get a second opinion. So all these have changed in terms of tech.
So do you see video consultation, which we hear a lot nowadays happening, especially when it comes to patient care, being the next big thing?
See, as I mentioned, I have experience of multiple domains. Now, healthcare is the only industry, especially hospital, where there's a human touch required. So, as a person will never want to go do a teleconsult without knowing. At least the first consultation, because I want to see the doctor, and the satisfaction what a patient gets after seeing the doctor. Okay, doctor has seen me, he's touched me, has seen my pulse. So that experience you can never take off the patient. Probably the follow-up consultation, yes, the hospitals are more want to engage the follow-up consultation, especially in case of your chronic patients or post-surgical case where the patient needs to come back to the hospital for a follow-up consultation. There is an opportunity, but not at the first consult, where the experience and the rapport building with the doctor, okay, this is the doctor, I'm in the right hands.
So, is there a correlation between hospitals now setting up smaller healthcare centers and driving patients, from there compared to visiting a normal family physicians, which used to happen years ago?
Yes, if you see most of the chain of hospitals, they are starting to have this satellite clinics in remote areas. So what happens in tier 2 and tier 3 cities, there are hospitals, let us take an example, what we have a hospital Rajkot or at a Nagpur, where people invest the entire day to come to the hospital, get themselves treated, take the report and go back. If we can give, taking example of Nagpur, we have patients coming from a periphery of 100 and 150 kilometers, where, so if we can have something there where the initial this thing is diagnosed, and like a satellite clinic, and there's a connectivity where a doctor can be, see the reports, and there are a lot of gadgets which are available which can capture the vitals at a real time, and the doctor will know, okay, this is a patient, and then if it is an emergency, only then he will be asked to come to the hospital. So this is the ease of patient. We are trying to ease the patient, because see, all patients are not mobile. There are patients who can't move. So for them to come to the hospital, if we have such facilities in and around tertiary, where he can just come a little distance, a kilometer, to the tertiary clinic or the satellite clinic, it makes a lot of business sense.
I personally have seen Wockhardt grow under your leadership. I mean, I still remember the day, when I had met you first in Mira Road center of Wockhardt. And we were talking typically from that on that day of 2 to 3 users or agents rather, would be deployed for customer experience. Now, over the past 5 years, we've implemented many changes in how the technology works. What have been some key strategies that help scale CX without losing the human touch?
See, as I mentioned, the first point of contact is the doctor, which is very, very difficult to take away. However, as I mentioned, patient engagement is the key in today's this thing. So, as a hospital, not only Wockhardt, all the hospitals want to retain the patient, and patient engagement is one of the activity which all hospitals, include Wockhardt, does. So, you take an example, whenever you try to take an appointment online. You take an appointment, so there is a notification, okay, your appointment is booked. Then you get a reminder that tomorrow is your appointment. So you please come if fasting based on what test you have done. So all these things are being fed to the patient. And also, we also are working on a thing where suppose I've taken with an appointment with a cardiologist. We say, know your doctor. So this is the first time you've seen the doctor. You have some anxiety, right? How the doctor would be, what is his background, is he famous, how many surgeries he had. So we send the patient a video of know your doctor. When he clicks, he knows the doctor, okay, this is the doctor I will be seeing, who will be seeing me, this is his background, he's done so much, he's so successful. So it's all about educating the patient, engaging the patient, and make him comfortable. So this is a level of customer experience before the patient actually walks into the hospital.
With rapid expansion, there is always a risk of process taking over patient care. How did you ensure at Wockhardt that you never lost sight of what truly matters, patient care?
Yes, so the main differentiator between healthcare and a BFSI is the human touch. So that experience, as I mentioned in my previous, that can never be taken away. However, some of the mundane activities like your online booking and all, where it doesn't matter and people know, okay, it will save his or her time to do an online booking, an online consult. Those are the areas where we feel we can set up a process to ease again, it is easing the customer experience. So he doesn't have to pick up the phone. Now he can go on online, do a booking, a payment. So these activities where there is a lot of time which is can be saved, and the ease of getting an appointment, ease of getting information, everything is available on the website. So you should have enough material on the website. Suppose I want to do a CABG or a plasty. If I go to the website, I need to know who the doctor is, who and what is his background, what does a CABG or a plasty looks like. So if all this information is available, because now the generation is quite tech, so they want to know more before they commit to anything. So if you feed the patient or the patient relatives, even the senior citizens are quite now tech savvy. So this WhatsApp university has now become very big, especially for the senior citizens. There's a lot of sharing happens.
A lot of sharing happening.
So people are well informed about everything they will be experiencing. So such activities where there is no human touch. Obviously, after coming to the hospital, there is a warmth, and so they need that. If you go to a different example, I'll give an example of a hospitality industry. I'm sure you must have gone to Taj Hotel. So when you go to Taj, they literally come, they will aarti utarenge, they'll put a garland. So that experience is different. Though you have made a booking online and everything, but when you enter that experience, you can't take away. It's a human touch. So all other things are fine, but then once you come within the hospital, how you treat the patient, how you greet the patient, when take regular feedbacks. So this is also, the NPS score is a very, very important benchmark for how you're doing. What does the patient think about you?
So in general, I mean, I'm just talking in terms of patient experience.
Yeah.
So the key takeaway which I get is, you ensure that it's not like the Munna Bhai movie कि यार वो stretcher पे आए और पहले form भरो.
Yes.
Right. It's more about taking care of him first, and then you can do the formalities later on. Wockhardt has several hospitals across India, right?
Yeah.
Managing the same level of customer experience is no small feat. So how do you ensure that every hospital or every person in the hospital takes the same patient care and gives the same customer experience?
See, if take up of Wockhardt or any other chain of hospitals, they are in different geographies. And each geography, you have to deal with each patient locally. I can't treat or greet or give the same amount of communication to a person. We have a hospital in South Bombay, and the same to the one at Rajkot or Nagpur. So it is a very localized thing when you actually interact with the patient, because the geography is different, the habits are different. So it has to be at a local level. It can't be, though you are a hospital, you're managing it centrally, there are some activities which have to be done locally. And that is where your local team plays a major role, especially your customer service people, the customer care. So you have to have a local language there. In Rajkot, if you talk in English, it will not happen. You have to have a person who is well versed with Gujarati, make them feel, okay, this is a person who understands him. I speak to him, he will give the right answer. So localization is very, very important wherever you go. So that
COVID was challenging for everyone. Again, the question comes is, if you can think of any incidents as to, in the peak of its COVID, and you also had to manage customer experience, what differently did you do to, help patient? Because everybody was frightened, right?
Yeah.
So what policies, processes, or any such incidents which you can narrate, it would be great, from a customer experience perspective.
Yeah, COVID was a experience of a lifetime. I just pray it doesn't happen again and again. But I would also like to thank the government of India for setting up that app where you could take there are two things when I'm talking about. One is your vaccination, and second is admission. So vaccination was very, very well handled by the government of India. They knew you could go on the website, you could book and then go to the hospital. When it comes to hospital, yes, there were a lot of restrictions where you could not travel. You could not allow people to come. You could not have patients to stay with their relatives because it was a very scary situation. But again, if your near or dear one is admitted, you have an anxiety to know how is our patient doing, whether he'll be live, what is the condition, when he is going back. So that communication between the patient and the patient relatives was a key, since relatives could not come, stay. So how to appraise the patient relative of the patient condition, that was the key. Whether you have a video call or you have a call with the patient or the nursing station, somebody should be there to answer, because when a patient is admitted and you are not allowed to go to the hospital, the anxiety level of the relative is more. So having the details of the patient's health condition and the communication, that was the key. Whether it be a nursing station would be available 24/7. So if I have a patient, I could call up and ask the nurse, how is my patient doing? Or secondly is video calling. If I'm able to talk to my person who's admitted. So these two things were the key thing where the patient experience.
So to give a better CX, I believe आपका IT has to be up to the mark.
Yeah.
So what steps, what processes do you follow to keep your uptimes always at 99.99? Because I believe if you are able to keep uptimes, तो आपकी CX or strategies automatically follow होगी.
Yeah, that's a very good question, because keeping in uptime in an industry that operates 24/7 is very, very difficult. Because I need to have some room for my maintenance. अगर मेरे को कुछ upgrade करना है, so I need that. So it's a very, very difficult situation for any CIO who's working not only in a hospital but wherever there's a 24/7 setup. So for that you need to have your infra very, very planned well. You need to have a redundancy. You have to have a active or this thing where you can afford to do a pilot testing in a environment which is not a production environment. So only once you are confident that आपका UAT testing is all done, you want to move it to the production, then you have to take a planned downtime. Again, when I say you have to take a planned downtime, it is not during the working hours. When everybody goes to sleep. Hospital में nobody goes to sleep. But when there is minimum of activity happening, like when there is no OPD happening, when there is no discharge happening, so we have to take it late in the night. So typical window is after 10 p.m. or even more after that, because a lot of backups happen at midnight. So the window available for us would be 2 a.m. in the morning to 6 a.m. where there is minimum activity happening, and that also a planned downtime, where we need to communicate to the end user, this time there will be system will not be available. Please, if there are any discharges, if there are any medication to be ordered, please do that. So it is a very tough job for the IT team to do this. It's like repairing a vehicle when it's running. Like performing a surgery on a live patient. Patient is there. It's very similar to that.
In the last 4-5 years, I've also seen a lot of CRMs coming which are specifically for healthcare. What are your views on it? I mean, बिकॉज 5 साल पहले मुझे लगता नहीं था कि कोई हॉस्पिटल में CRM सिस्टम होगा. HIS सिस्टम्स वे देयर, बट अब मैं देख रहा हूँ कि देयर आर हेल्थ केयर स्पेसिफिक CRM सिस्टम्स. सो व्हाट आर योर व्यूज ऑन इट, एंड हाउ हैज इट हेल्प Wockhardt know your customer, take your customer to the next level?
Yeah, CRM, when you speak about customer experience, a vendor is also a customer. So when you talk about a CRM, you're also allowing vendor to come in your system. The main is the CRM, when you open it, you have your vendors who can monitor what POs have been raised, what is the status of that. So it is, for us, a vendor is a customer like a patient. So if I have, quite some time back, a CRM was not there. The hospital operations were limited only to the people within the hospital. Now with post-COVID, something what good COVID has done is opened up the hospital to the others also. Like you say you have mobile apps for everybody. You have a mobile app for a doctor, a patient. So people want, again, the ease of use, how they can use the system when they're not there. They want to make a payment, and similarly vendors. Vendors want to, it's all about how convenient it's for them to not to come to the hospital, do everything online. So the CRM is helping all the hospitals. We are also planning to have a CRM where we want to engage our vendors who are actually our partners. You are also a partner for us. So it's again ease of operations. So if the ease of operations vendor will have that delight, okay, this hospital has a CRM, so it's easy to work with them. So it's raising the bar for the enhancing the customer experience.
In the last couple of years, there have been, a lot of changes when it comes to security compliance or the new Security Act.
Yeah.
Love to know your views on the new Security Act, Data Security Act.
See, there's a new act which is coming, this is a DPDP. It is a Digital Personal Data Protection Act. So it is not only applicable for the hospital industry, it is applicable for all. So as of now, there are only guidelines that have come. And everybody is too scared of, because the penalty is very high.
Okay.
It is in crores. If there is one non-compliance, it's very, very high. It's still in a very, very nascent stage. So what it does actually, DPDP, with whatever limited knowledge I have, DPDP Act is, suppose you are a customer of Wockhardt, you have given your personal information. How does the hospital or any bank, you can take an example of wherever you are giving a personal information like a mobile number, your PAN card, that how the hospital or a bank or any is able to protect that. So that is all about DPDP Act is protecting your personal information. And you as a customer of that particular hospital or bank or any other where you've given a person, you can demand that my personal information can't be shared. So previously what was happening, whenever you do anything, there is a consent form or an agreement where it says, I agree to the terms and conditions. So you've given a blanket permission to use your data. Mm-hmm. How many people go and click that site and say, read the entire document, what does it say? You just click the checkbox and say, yes. I am okay, you can go ahead. But that is, they don't know what is behind it. Now, again, when you come to the DPDP Act, it is your patient, the privacy of data. So there are two things, privacy and security. When you talk about privacy, it is just not privacy. Privacy and security go hand in hand. So privacy is who can view your data. Suppose in a hospital, who can view the data. So are the right people viewing your data? If you are like a VIP or a person who's admitted, he will not want everybody in the hospital to view your data. So how do you take care of that? That is very important. So first is your privacy, and second is a security, where you have your cyber security people having taken additional care that there's no leakages. But the bigger game is how do you, the inside threat is more than the outside threat. Because you go to any hospital or anything, just a generic statement, you have papers lying around here only. You go in the lift, people are discussing about your medical treatment. Then what rights have been given to the nurses, whether one doctor can see the other patient's data who is not under admitted. So all these are your internal threats where the privacy of data. So who's supposed to do what? And the security is how do you prevent a malware attack. Recently, one of the big hospitals had this attack, a ransomware attack, where people from outside had entered this thing, and the hospital was not functioning electronically for a couple of days. So these two things are now very important because people have now understood the value of data, healthcare data for particular. It doesn't have a value. It is like in a bank, but the patient data is very, very expensive. And so if the data is stolen, they can demand anything.
So recently, Saif Ali Khan ka incident hua tha.
Yes.
Right. Because you spoke of the DPDRD Act, we saw on social media that his insurance claim was available online. So what measures should an hospital take typically for such kind of incidents don't come, because it's a very personal data which has come out.
Yeah.
Right. So what are your views on it?
See, if you see in the last question, we spoke about privacy and security of data. So whenever a high-profile person, be a politician, be a actor or a sportsman, is admitted to any hospital, the first thing is his identity is masked. So even if his reports are generated, this is the standard operating procedure for any hospital, be it Wockhardt or anything. We first mask the identity of the personality, and then the reports are generated. So even if the reports are being processed in a lab or where the person, the technician, lab technician doesn't know this belongs to this VIP person, without naming him, a VIP person. So this is one level of data privacy. Second is, this is from the IT perspective. Second is, like I mentioned in the privacy, who is to see whose data. So we need to take care that if a very high profile person is admitted under a doctor, the viewing rights of his particular records are not given to anybody else. So here you are safeguarding the privacy of the data. So this is one, this thing. And second is, this is from the IT perspective. So this makes the person safe. Okay, I am admitted in this hospital and I'm confident that my data will not be leaked. So from the IT perspective, we can do that.
We all know AI is the new buzzword.
Yeah.
Okay. What do you think, or how do you integrate AI with your hospital operations and IT and to boost the customer experience? And what are your steps, or what are you planning to do when it comes to integrating AI into your day-to-day operations?
Yeah, if you see, AI and Gen AI are the new buzzwords, and everybody wants to jump in the train without even thinking whether it's possible or not possible. So what is the genesis of AI? It is the data. You need to have data at a granular level very accurate. If you don't have the data at a granular level, how are you going to use that AI or Gen AI? We'll take a simple example of a registration form. Okay, so this is a typical example in most of the hospitals. So I'm just talking a very generic thing. What do you fill in the generic form? You fill your first name, you fill your last name, then there is a set of questions of your address, your PIN code, your city, your email address, then maybe your phone number. There are a lot of information. So how much of information is correct, and how much are you actually filling? Do you have that set of data right? So if you don't have the address correct, like if you not enter the PIN code or the city, and you want to run a campaign in a particular city, but in the data where you see, half of the patients registered don't have that PIN code registered. So educating first is understanding AI, how are you going to use it. First you have to correct the data at a very granular level. You need to educate the person who's entering. See, what happens is, the person who's using the dashboard and person who's entering, there's a big difference. The person who registration desk pe hai, he wants to save his time. So he will just put a dot and go. He doesn't know the importance of putting the PIN code or the city or the phone number or an email address. Taking an example of an email address. If you don't put the email address correct, tomorrow after investigation you have to email now wherever you go you get your reports on an email. So you don't get the report. So before we use, we have to get the basic right. So this is the genesis. So there's a lot of attempt now being made to correct the granular data. Once you have that data at a very granular level correct, you have educated the person who's entering the data. Okay, I am entering, if I don't enter, this would be the bigger picture. He doesn't know the bigger picture. So this will collapse. So there's a lot of emphasis on that. And again, what does it translate to? Tomorrow there's something called a NPS, Net Promoter Score, where a feedback is taken from the patient about his or her experience in the hospital. Tomorrow the patient will say, अरे मेरा सबको WhatsApp पे report आ गया, email पे आ गया, मेरे को नहीं आया. So this are very small things, but what does it translate to? It translates to very big. And if you don't have that, you can't achieve that. So this is what the basis of AI or Gen AI is. You have your basics right, only then you can use it. So people want to use it because, okay, they will claim, okay, we are using AI.
If you can tell us about a couple of initiatives which you at IT department have taken which has helped hospital achieve greater customer experience.
I believe everybody has gone to the hospital. So what is the biggest pain of a patient who's been admitted and who wants to go out? What is the biggest pain? Can you guess?
Biggest pain in terms of
For a patient who's well and he discharge.
getting quicker discharge.
Yeah, this is the biggest pain of any patient. Like doctor has advised him, okay, you're okay, you can go home, but due to some reasons, your insurance doesn't. There's a delay in the process of discharge. The anxiety of the patient is so high. अरे doctor ने मेरे को बोला I have to catch a flight, I have to go. So that anxiety is so high, and in that process, if the discharge gets delayed, something is not in your hands because you have an insurance, you have done the billing. The billing information has gone to the TPA or the insurance, and you are waiting for a insurance to give you a green signal. Okay, your insurance is approved, and then you can go. But there's a lot of delay in the insurance process. Why? Because there's so much of documentation and back and forth happening. अरे फिर इंश्योरेंस बोलेगा दिस इज योर पॉलिसी, these are what are inclusions, these are exclusions, you are not allowed to do this, etc., etc. Plus they will ask, you give me this report, you give me that report. Then you have to scan a lot of mails and the communications sent by you. Then you tell the hospital, this bill we want, doctor ka ye chahiye, we want a doctor to be told that uska surgery karna tha. There is a lot of documentation. And it is across your mails, across everything. There's something called RPA, that is, robotic process automation. I'm sure you must be knowing.
Yeah.
This most of the hospitals are using for your claim processing.
Okay.
Where a lot of information is scanned from the different sources and fed to the insurance. So this has eased a lot of manual work which is for this thing. And this is one thing which has brought down the discharge time considerably, but there is still a lot of room to progress on this. We can still, after this, we can still see how we can use AI for a faster discharge process. So because the faster the discharge, the better the customer experience. The customer wants to go home as soon as he knows doctor is certified. So a lot of effort has been taken by all the hospitals. Okay, patient could discharge, how soon can we discharge? So there are certain parameters or certain targets set. अगर ये planned discharge है तो उसका 2 घंटे में होना चाहिए. Everything should be completed the previous night. So there's a lot of emphasis on the hospital to have the discharge. Again, it is directly proportional to your revenue. अगर bed खाली होता है तो you can also take new patient. One is increasing the patient experience, and second is also the revenue.
I know you're always thinking ahead. What next for Wockhardt? What are your plans in terms of patient care, in terms of customer experience?
See, we are at a stage where we are in the process of digitalization. We have engaged a new vendor who will help us in digitization. We want to go paperless. So these are the two things. The more you do digitization, the more the scope for AI. Because as I mentioned, digitization is the genesis for using any technology. So we are trying our best how to digitize most of our functions, how to automate most of our functions, and a CRM. So we are looking at a vendor who is our patient. We are looking vendor as a customer as a patient. We are looking customer as a vendor. So how can we ease them, and also how to go paperless. We want to save, we want to go green. So this is what contribution we can do to the ecosystem.
On that note, we end today's episode of In Talk with Girish. Thank you, Girish, for joining us and giving us your valuable time and your valuable advice and your valuable messages. Okay, we hope the viewers enjoyed it. Thank you very much once again. Thank you.
The pleasure is all mine, and thank you once again, Digish and team, for having me on this show. Thank you.